All right, next up we have VCU Health.
Okay, hi everyone. My name is Garrett. This is Chase. We're from the VCU Computer Science / Health team.
And we have a blank screen.
And so we're talking about how we can use dynamic heat mapping to bridge the gap between overdose and recovery. So what does that mean? So first, let's talk about why this approach. So the governor said yesterday, 1,100 people died from overdose last year in Virginia. But what about those people that overdose, they are resuscitated, and then they aren't accounted for in the data that we have? So patients, interestingly enough, when we talk to our EMS personnel, we have learned that patients can overdose, they can receive Narcan on the scene, they can respond and resuscitate fully and completely, and then they can decline to go to the emergency department. So this data is lost. Secondly, for patients being discharged from the hospital, there is no transition. They are not given any follow-up when they're discharged. So there's no long-term care to influence any positive prognosis that we can have on these patients. So the question that we're going to talk about is how do we break this cycle and how do we catch this data?
So to begin, we built this data visualization here that overlays the current outbreak locations with the current treatment center locations. And we can clearly see here that there's a discrepancy between where treatment is available and where these outbreaks are occurring. So the first issue that we want to solve is how do we get resources to these people in these outlying areas that need it? And secondly, we can see that when we were looking through these data sets, the data is only available at a county level. But when we were talking to the EMT personnel, we realized that that's not good enough. We need higher resolution data. We need to know the individual addresses that these incidents are occurring so that we can pinpoint the exact locations in the community where these hotspots are showing up and we can get help there fast. So how do we do that? So it's actually really easy. So this is an example right here of a form that an EMT personnel would fill out when responding to a scene. And what we're proposing is just adding 3 simple checkboxes to this form. So the first is we want to know if the incident that is involved, was reported involved narcotics. The second one is we want to know, did they administer Narcan as a response? And third and most important is we want to know the location that this event occurred. Why do we want to know that? Well, we want to know that so that we can apply machine learning techniques to actually predict these hotspots. So this is an example of the second tool that we developed as part of this datathon. Now, unfortunately, like I said, these data sets aren't available, so this is just with dummy data. But the idea is that we would use this model to predict where these hotspots are going to show up so that we can tell the EMT personnel, hey, at this location, you're probably going to have an overdose event, with the idea being that we can enhance the response time and reduce the latency so that these individuals can provide life-saving treatment to the people that need it.
And the second advantage is that we can use this data to direct these resource-limited departments, such as the substance abuse and rehabilitation programs, the public health and community efforts, and then the law enforcement, so they can hone in and funnel their energy together to offer this interprofessional collaborative effort that can subsequently address these much-needed dire areas. And so another yield is that we can take this data, this hotspot data, and then use that as a focal point from which we can develop these urgent recovery centers. So it's to the like of what we have already, kind of like Patient First, Better Med, Now Care. And so EMS can deliver patients to these urgent recovery centers as opposed to the ED, thereby alleviating the ED burden. 2, you have increased and faster access to life-saving intervention. Again, opioids are not poisonous. You need to have intubation. You need to have first responders who can actually intubate and deliver this life-saving intervention and thereby subsequently decrease mortality rates. Then you also want to bridge outpatient therapy. So when you have these clinics, you can have standby substance abuse specialists and have them ready to transition them to long-term care.
So how do we do this? So as I said before, we can integrate easily on top of the existing EMS reporting system with really little or no cost to the personnel and no added time or energy. The important thing is that we would have to put data-driven informed policy that would encourage the EMT personnel to take people not to these hospital OR rooms or emergency rooms, but actually to these specialized clinics so that they can get the help that they need from specialists trained in that field. And not only get the help that they need immediately, but also get information that they need to go to long-term care centers so that we can break this cycle of people overdosing, going out in the community, and overdosing again. Thank you all.